And just to remind you, this is a webinar for early care and education providers. We are going to be sharing information about Measure C. There will be an opportunity for questions and answers at the end of the webinar. So if you have any questions, so that you don't forget, please write them on a piece of paper, and we will be going over them at the end. I'm sure some of them might be addressed as we continue with the presentation. And again, if you are just joining in, we'll be adding instructions on how to access simultaneous translation in Spanish or Chinese to the chat. If you have any questions on that, please let my colleagues know. And again, thank you for participating in that little exercise. As a reminder, before we officially begin, this is going to be recorded. And for those of you who signed up, you know there's another webinar coming in July. It will be the same webinar as this one. So don't feel like you have to attend both. But if we don't address all of your questions today, you're welcome to come to that one and also be part of the questions and answers section of that presentation. And I know we are already recording, I believe. So as a reminder, this presentation is designed for early care and education professionals. So we will be going over the 101 of what is Measure C and information that is relevant to them. If my colleagues could send me to the next slide. And before I pass it to my colleagues, I do want to give you a brief intro to our agenda. So we're going to move a little faster. If you can move me to the next slide, please. So again, we're going to be going over Measure C, what it is, how it's going to work. Then we're going to go over the next first steps of implementation and share ways you can connect with us. And we will be moving to the questions after that. Now, to introduce our leadership team and speakers, I'm going to pass it to our Chief of Staff, Vanessa Cedeño.
Good morning. Good morning, everyone. Thank you for joining us this Saturday morning. I'm very excited to have such interest in who First Five is and what Measure C is. So I wanted to introduce our executive leadership team, our CEO, Kristen Spanos, our Chief of Programs, Ayano Ogawa, our Deputy CEO, Callie Martin, and of course, as Itzel mentioned, I'm the Chief of Staff here at First Five. On behalf of the entire leadership team, we are humbled to be the administrators of the child care account for Measure C, and really excited to begin engaging our ECE professionals in the work of implementing the measure. Today, you're going to hear from 4 of the First Five team members. The first is Vince Chang, our ECE Provider Partnership Senior Administrator. Some of you may already know Vince, as well as Ana Apodaca, our Government Affairs and Policy Officer, and you have already met our Strategic Communications Officer, Itzel Diaz-Romo. Next slide. While you will only hear from 4 of us today, we did want to shout out our entire First Five team. Everyone in our agency will be supporting in some shape, way, or form the Measure C implementation process. So want to acknowledge and recognize that it is a whole team effort, and we will do it in partnership with all of you. Highlighted in yellow is our ECE team division, which sits within our community programs department that is overseen by Ayano. Next slide. First Fives were created over 25 years ago by a state voter initiative called Proposition 10. Prop 10 intended for First Fives to create an integrated, comprehensive early childhood system of care. We at First Five are so fortunate that with the influx of new local dollars like Measure C, we have the opportunity to really realize the vision that Prop 10 intended for First Fives, which is to create a robust, equity-centered early childhood system of care that truly supports families with young children in our county and the providers and caregivers that support them every day. And we do this with a whole community, whole family, whole child approach. Next slide. So who is First Five? As I mentioned, First Five was created through a state initiative called Proposition 10. And we are a public agency. We are a county level agency. And our role is to build an early childhood system of care here in Alameda County. And we do so by funding organizations, partnering with families and community providers, our elected partners, and other systems. We administer programs like our pediatric care coordination program, Help Me Grow, and we will now be administering Measure C, as well as the Oakland Children's Initiative. And finally, we advocate for policies and investments that support families with young children. Next slide. As you saw in the flower visual, our North Star is that all children are ready for kindergarten. That is the population measure that guides all of our work. And we do this by addressing the conditions that support families and children and the caregivers and providers who support them through policies, systems, communities, and other supports. Next slide. Now, with that overview of who First Five is and what our role is, I want to turn it over to my colleague, Ana Apodaca, to provide you an overview of the Measure C Child Care Account.
Thank you so much, Vanessa. Good morning, everyone. So we're going to go specifically into detail on Measure C, the Child Care Preschool and Early Education Account. As you know, next slide, please. As you know, we are very fortunate here in Alameda County to have two local child care ballot measures. We have the Oakland Children's Initiative, which contracted early education implementation partner, and we began implementing that program in 2023. That is specifically for the city of Oakland. Today we're going to do much more in-depth focus on the Children's Health and Child Care Initiative for Alameda County, Measure C, which First Five is the named administrator in the ordinance. It's a 20-year half-cent sales tax that raises approximately $150 million annually to provide support and enhancements for childcare, preschool, early education, and pediatric healthcare in Alameda County. The funds will be divided into two sub-accounts. A pediatric healthcare account will receive 20% of the funds, and that will be overseen by a citizen oversight committee. The second account is a child care, preschool, and early education account, which will receive 80% of the funds, and that will be administered by First Five. We are very fortunate that the State Supreme Court upheld Measure C in its entirety on April 24th, and now we can begin implementing it. Next slide. The ordinance is explicit in that it requires a process for developing an annual expenditure plan and 5-year plan on how the funds will be used to meet the following components: increase access to quality care for Measure C funded providers through new enrollments and rate enhancements, improve compensations for participating early care and education providers, enhance professional development programs and the eligibility and enrollment system for providers, and improve community spaces for children and families, such as parks, libraries, and family resource centers. Next slide. There are two governing bodies that oversee the implementation of the child care, preschool, and early education account. That includes the Alameda County Board of Supervisors and the first 5 Alameda County Commission. The Board of Supervisors are responsible for establishing the Community Advisory Council. We will call it the CAC. CAC is our acronym we're going with. Appointing members to the CAC, conducting the annual independent financial audit of Measure C, revenues and expenditures, approving a 5-year program and budget plans, and annually appropriating funds necessary to carry out the plan's annual budget. The first 5 Alameda County Commission is responsible for approving the 5-year program and budget plans and approving the annual expenditure. Since the Community Advisory Council is new, we're going to go into depth about that. The ordinance creates an 11-member Community Advisory Council, which serves as an advisory body, and it will be staffed by first 5 Alameda County. The CAC will develop policies and programmatic recommendations related to the child care, preschool, and early education account. It provides input to the 5-year program plan and annual expenditure plan. These 2 plans will then need to be approved by the Board of Supervisors and the first 5 Alameda County Commission. The Community Advisory Council will need to be established by the Board of Supervisors within 45 days of the effective date of the ordinance. So that the Board of Supervisors did establish it on June 4th. The Board of Supervisors and the local planning council will need to appoint council members within 120 days of the effective date of the ordinance. The CAC members will serve 3 4-year terms, so a maximum of 12 consecutive years, with the exception of the first class, which will serve 2-year terms as determined by lottery in the first meeting. Next slide. As outlined in the ordinance, there are 11 appointed seats, 5 of which will be appointed by the Board of Supervisors and 6 by the local planning council. The measure defines specific criteria for each seat and the appointed body. As you can tell, right now we have on the screen that there are 5 seats under the Board of Supervisors, their seat designation and rules, as well as additional requirements, and all of this is in the measure, as well as a local planning 6 seats, their seat designations and role, and their additional requirements. Next slide. The role of first 5 as the administrator of the funds is to develop the 5-year program plan and annual expenditure plan, staff the Community Advisory Council, develop, implement, administer, and oversee all programs and services paid for by the child care, preschool, and early education account, develop the program plan, evaluate the program and services, and operate with transparency and public accountability as good fiscal stewardships of the account. The measure language was written with the intention for there to be a planning year to allow for the development of the plans. And we can share with you that through our experience with the Oakland Children's Initiative, that year of planning is crucial to build the infrastructure for an equity-centered and early childhood system that supports family with young children and the workforce. Next slide. So here's our implementation timeline. With the legal resolution being final as of April 24th, 2024, we can now begin the implementation. And part of that, we have to have the Board of Supervisors establish the Community Advisory Council, which they did on June 4th. The Board of Supervisors and the local planning council will need to appoint the 11-member CAC Advisory Council by August 22nd, 2024. And then we can begin the 5-year plan and budgeting that will occur in the next year, May 2025. All of this will need to be approved by the first 5 commission and the Board of Supervisors for approval. And now I am going to turn it over to my colleague, Vincent Chang.
Hi, everybody. Thank you for joining us today. And it's nice to see many familiar faces here. So now let's share some ideas for initial first steps. And as you just heard, it's important to remember that there'll be lots of planning for the implementation still of Measure C over this next year. But we did want to share some general ideas to support us building a system that is easy to understand, easy to use, and is investing in the right places. And please remember, these are really draft ideas because we will need your input and broader community input into the final designs of the program. Next slide, please. As mentioned, we want to build a system that's easy to use and understand, and we will need to work with our existing system that we have. Measure C requires increasing access to quality early care and education. It requires supporting the workforce with increases in their wages and salaries, and requires the use of a centralized eligibility list for income eligible ECE programs. So you can see here that working on facilities, using technology, using data and evaluation, and investing in the workforce are some of the initial, what we like to say, big bucket strategies we're looking to implement. It's also important to remember, because there's not unlimited amounts of money, there will be requirements for participation and priorities for who and which programs will be able to access Measure C supports first. So some ideas for these requirements are serving some minimum percentage of income eligible children and families, being able to verify teachers' wages and making sure you're paying a minimum salary level, giving information and data about your programs, and using and participating in the technology that will be part of the Measure C system. Okay, next slide, please. So creating beautiful spaces for children. If we want to increase access to quality ECE, we will need healthy and beautiful places for children and ECE professionals to be in. So facilities that we refer to are the spaces and environments where children, families, caregivers, and ECE professionals spend time playing and learning. So we're talking about classrooms, playgrounds, family childcare homes, and other community places where children are cared for. We have selected an initial contractor that will be helping us with what we're calling the Early Childhood Facilities Fund, and will be providing technical assistance. So right now we are moving forward with the contracting process with this contractor. So there'll be information sessions in the future about Facilities Fund, so stay tuned for those dates with us. Okay, next slide, please. Another way that we want to increase access for families to childcare or early care and education is to utilize technology to help coordinate and connect all of our participating programs. So there's one place families can go to get information and get on an eligibility list. Our current system we have is fragmented. We have over 30 different income eligible program options in the county, but there's not one place to get on this eligibility list. So unfortunately, we don't currently have a coordinated system that makes it easy for parents and providers to connect with each other. So the vision is to use navigation technology to make sure families have all the information, options, and support to choose their preferred early care and education experience for their child. To help us make navigation easier for parents, participating ECE providers and programs will be required to use the technology that we will be implementing so that we can have a one-stop shop for childcare for families. Next slide, please. So also, in order to develop a well-informed program design and strategies for Measure C, we will be needing information and data from ECE programs, ECE professionals, and families. We do already have a lot of this data and information, but we are missing other pieces of information, like how many ECE professionals do you have on staff, and how many staff vacancies do you have, or what are their wages, or where exactly do families want or need care for their babies. So something for you to look for in the near term is a survey. We're doing an initial survey of our community to start learning about the needs. And we hope to launch that survey later in July to help us begin to fill the information and data holes that we have. There will also be future opportunities to participate in focus groups or planning sessions to help further refine the ideas for the Measure C programs. So stay tuned for that as well. Measure C also requires us to do regular evaluation on the effectiveness of the investments. And data helps to operate the programs with transparency and allow to report an impact. So in order to meet that, participating providers will be required to report information to us, like your enrollment and vacancy numbers on a regular basis. Information about your staffing levels, vacancies, compensation, and wages, especially since Measure C requires raising ECE professionals' wages. So using new technology to help with this requirement will be important. We also realize that people have different levels of technology skills and comfort with technology. So supports with training and technical assistance are being thought about, along with providing the physical items like laptops and iPads as needed. Okay, next slide, please. So the ECE workforce. So we know the biggest challenge with the ECE system now is with our workforce. We just don't have enough qualified people to care for and educate our young ones. And the reason is simple. We haven't been able to pay people enough to make it a sustainable career with all the educational and permit requirements. The Measure C ordinance requires that resources go towards improving wages for ECE professionals. In my opinion, caring for young children is one of the most important professions we have. But unfortunately, our society hasn't shown the same value in the work by investing in it. So we have historically low wages. Measure C looks to change that. Along with the wages, we need to build what we call pipelines for people to enter or advance their career to get the proper education, certifications, permits, and qualifications. That means helping to pay for college so people can get their units, and even possibly paying people for their time to take the classes. That means giving people access to take the classes that fit their schedule, since we know many are already working and can't take classes during the regular workday. That means offering language supports as needed for people to be successful in their classes. It means making sure when people get their qualifications, they have access to good paying ECE jobs. And it could mean other supports that the community helps us to identify and create. And now I'll pass it back to my colleague, Itza.
Thank you, Vince. Well, for those of you who join a little later, just a reminder that we're going to be taking questions at the end, and please put them in the questions and answer box at the bottom. Now, I want to encourage all of you, especially if you are providers, to sign up to our newsletter. In the upcoming months, we'll be sending out communications with opportunities to engage and provide input that will help inform the implementation of Measure C. These opportunities are going to be shared primarily on our newsletter and social media and through our partners. So I really encourage you to sign up to that newsletter. It's a quick form to follow us on Facebook, Instagram, LinkedIn. We are also on X, formerly known as Twitter. And you can be the first to receive updates by signing up or following us on social media. And now, before we move to the questions and answers section, I want to remind you that all the materials that were covered today are going to be available on our website in different languages in case that you want to go back and read them on your own for your own understanding. I'm going to ask my colleagues to drop the link on the chat for everybody so that you can have access. The materials that you will be able to see are the slide deck that we are presenting today, and also one sheet about Measure C in multiple languages. Now I'm going to ask my colleagues to stop the recording, and we are going to move on to the questions and answer section of this presentation. I want to take a moment just to thank all of my colleagues for being here and helping provide this information, all of you for being here on a Saturday morning and giving us 1 hour of your time. And also thank our amazing interpreters, Heidi, Sol, Elaine. I'm bilingual myself, and I know simultaneous translation is quite a challenge. So I got a little note to myself, speak slow. Because I know the challenge is real. So know that we appreciate you. And finally, if you have additional questions, I encourage you, there are multiple ways to get information. You could sign up to our newsletter, as was mentioned multiple times, follow us on social media, visit our website. All these materials are already posted there in multiple languages. You can reach out to Vince. He's really our ECE expert and can answer any specific granular questions that you have. You can also reach out to my colleague Anna or myself if you have other type of questions. But like I say, there will be a lot of opportunities for you to engage and provide input into the planning of this measure in the next few months. One of the opportunities is going to be that survey, not to be confused with the survey that is going to go to you right after this webinar, the one that you will receive right after this meeting. And I believe my colleagues are also going to put the link to that in the chat. That is just for us to know how we did today. This is our first webinar as a team, so we want to know how well we did, what we can improve on, and the only way we can get better at providing information to you is with your feedback. So I really encourage you to go in there. Be honest, you won't hurt our feelings if you tell us if we didn't do so great. We're doing another one in a few weeks, so we want to make sure it can be the best and useful it could be for all the providers. So I think with that, I'm going to close us up. And then again, if my colleagues could put that link in the chat for the survey, you are also going to get an automated email from Zoom with the link to that survey, and the link the survey is translated as well. So feel free to answer it in Spanish, in Chinese, like we're going to be translated the answer. So don't feel like if you speak another language, you cannot respond. I really encourage you to go ahead and give us your feedback. And again, thank you everybody for being here, and we'll give you back the rest of your Saturday. Have a great day.